As Zimbabwe gradually moves towards full-scale digitization of services in line with government's artificial intelligence strategy, the emergency healthcare service is set for an overhaul through the rollout of a medical services drone delivery program. In our science and technology feature tonight, our reporter Panashe Nagoli looks at harnessing drone technology to provide emergency medical delivery services, especially in once marginalized areas.
The idea of a drone delivery system always seemed like a distant technological dream for Zimbabwe. Government is, however, addressing the situation by intentionally focusing on bringing in modern equipment and crucial services such as the air ambulances to improve the healthcare system. Once marginalized areas in some instances found it difficult to access healthcare. As technology advances, Zimbabwe is catching up, with Mr. Jeremiah Msabayana and his team harnessing the latest technology to modernize healthcare through the introduction of a drone delivery system.
Access to any medicinal or pharmaceutical products is very limited, especially when you are speaking of emergency cases. One is bitten by a snake, one needs to access antivenom and so forth. We then look forward to the hard-to-reach villagers or villages having access to these emergency pharmaceutical or medicinal drugs.
But how exactly does the technology work, and is it feasible operationally?
We are going to be setting up air bridge drone corridors around the country. Ideally, we are going to be having hubs at each and every referral or major hospital around the country. And we shall be setting up small hubs as well on quite a number of the small clinics as well. So these products will be accessed through clinics, through hospitals, and through any other area that can be identified as a hub.
Now, a quick tour of the Drone University Flight School gave us a glimpse into how the drone delivery program will actually work.
What we have here is the kite aero drone. So it is a hybrid drone. This drone is made in such a way that it's easy to use. To say if the drone is to go in a remote location where you have people in the rural areas, all they have to do is they have to just press this button and then the drone will take off. And then you also have your compartment here where you'll be storing your packages, your different packages for transportation within this compartment. And then you also have your forward motors, and then you also have your pitot tubes for testing things like your wind pressure.
Public health expert Dr. George Ripanyanga is of the view that this technology will greatly improve access to universal healthcare, especially for rural communities.
There is a big gap in terms of delivery of medication. At times you see a patient in rural areas and you prescribe a certain drug. It's not available in the rural areas, so there's difficulties in accessing that drug in rural areas, and that drug is available maybe in urban centers like Harare, Gweru, or even Bulawayo. So it's easy for the drug to be transported from these urban areas, from the capital city or any other big cities to the rural areas, and the cost is going to be very minimum, or it's going to be very cost effective to transport these drugs, which means the ultimate cost to the patient is going to be reduced.
The United Nations Sustainable Development Goal number 3 aims to ensure healthy lives and promote well-being for all ages by the year 2030. Thus, this program places Zimbabwe a step closer to achieving that goal. Panashe Nagoli, ZBC News, Harare.